For disease investigations where foot and mouth disease may be a differential diagnosis, it's preferred to leave your vehicle at the premises entrance, negating the need for vehicle decontamination at exit. If possible, have the boot of your vehicle close to this entrance, as it could serve as an extension of the clean side of your personal decontamination site. Select and set up a personal decontamination site at the periphery of the uninfected or cold zone and the infected area, also called the hot zone. In the case of foot and mouth disease and other diseases where vehicles can act as fomites, the preferred site is usually at the premises entrance. Set up the personal decontamination site using a small disposable drop sheet or large biohazard or garbage bag that can be used as a surface to work on. This site should have a defined clean and dirty area, demarcated by an imaginary line which should be observed at all times. On the clean side, place all equipment, including personal protective equipment and other items that you intend to take onto the property. Make sure you have adequate supplies, as you'll need to undergo complete decontamination in order to exit the premises. And all items must be within reach from the dirty side when undertaking the exit procedure. On the dirty side, place one tub containing water and detergent, and one tub containing water and a suitable disinfectant, such as Virkon, to allow cleaning and disinfection during the exit procedure. Near the disinfectant tub, a biohazard bag can also be positioned on the dirty side, which will be used to collect contaminated disposable items during the exit procedure. Personal items such as mobile phones and car keys, and all paperwork that may be required on the premises, should be placed in clip-seal bags to allow decontamination during the exit procedure. Place a garbage bag in the cold zone in which to dispose of items, such as paper towels that are used only whilst you are on the clean side. Remove excess clothing and personal belongings, including jewelry, and place it safely in your vehicle and apply sunscreen if required. Wash your hands with soap and water and dry thoroughly using paper towels. Place paper towels in the garbage bag on the clean side. Check your hands for any cuts and cover them with waterproof dressing if necessary. Systematically spray disinfectant on all equipment and clip-seal bags containing items to be taken into the hot zone before placing it across the imaginary line onto the dirty side of the drop sheet. This is a biosecurity risk mitigation measure and also ensures that you're not seen to be potentially bringing infectious agents or contaminants onto the premises. Such items and equipment may include a suitably sized esky and adequate ice bricks to maintain all samples collected at or near 4 degrees Celsius. All sampling, examination and animal restraint equipment. All paperwork and a pen which has been secured in clip-seal bags. Personal items such as mobile phones and car keys, also secured in clip-seal bags. Detergent, scrubbing brushes, and a hoof pick or screwdriver for gross cleaning, including of boot treads at the gross cleaning site in the hot zone. A bucket used for gross cleaning in the hot zone and also to carry items onto the premises. Spare disposable gloves and disinfectant wipes in case your gloves are torn whilst on the premises. Sufficient bottled drinking water and a sharps container. Remove your footwear and leave it in the cold zone between the drop sheet and your vehicle. Remove excess clothing. In summer and for biosecurity reasons, it's preferred to minimize clothing worn under overalls. Shorts and a t-shirt or singlet is appropriate. In colder weather, heavier clothing may be necessary, but the risk of soiling these clothes through overalls should be considered. Alternatively, 2 pairs of overalls could be worn. Put on disposable overalls over the top of your remaining clothes. Do the zipper up to your chin. In warm weather, avoid pulling up the hood at this stage to reduce the risk of heat stress. Put disposable impervious overalls or waterproofs over the top of the disposable overalls in the same manner as the first. If wearing 2 pairs of disposable overalls, tuck the first pair inside the rubber boots, but ensure the legs of the outer pair are placed over the rubber boots and pulled down to cover as much of the boots as possible. This will prevent liquids and other contaminants entering the boots. Don 2 pairs of disposable nitrile gloves. The cuffs of the first pair of gloves should be placed under the sleeves of the overall. The cuffs of the second pair of gloves should be placed over the sleeves of the overall. Seal your outer pair of gloves to the outer pair of disposable overalls or waterproofs using duct tape. Fold the tip of the duct tape inwards. This creates a tag to make it easier to remove. At this stage, you can pull the hood of your overalls up and do the zipper up to your chin. This concludes the procedure for putting on PPE where no respiratory protective device is required, as would be the case for foot and mouth disease investigations. Respiratory protection is essential where there's a potential risk of exposure to airborne zoonotic infectious agents, including through contaminated dust or aerosols, and airborne chemical hazards. We'll now demonstrate the steps required to put on 3 different respiratory protective devices: a powered air purifying respirator or PAPR, a full-face negative pressure respirator, and a disposable P2 particulate respirator and protective eyewear. The powered air purifying respirator is suitable for use by personnel with facial hair, for example a beard, or those wearing spectacles. Remove air filters from the packaging and screw onto the body of the device. Thoroughly disinfect the device with a suitable disinfectant, as you did with all other equipment and items that will be taken onto the premises. If fitted, remove the plastic coverings from the filters that have been attached to the device. Switch on the device. There should be an audible noise as the device starts to work. Put the device on by securing the straps around your waist and positioning for comfort. Put the hood on and ensure a proper seal. The full-face negative pressure respirator isn't suitable for use by personnel who are not clean-shaven, who wear spectacles, or who have facial features preventing a suitable seal. It's imperative that the device fit properly and that the fit test is undertaken. This initial fit testing should be undertaken when the respirator is first acquired. Remove air filters from the packaging and screw onto the body of the device. Disinfect the device and wipe the screen clean with a paper towel if necessary. Secure the device over your face by tightening all straps, starting with the neck straps, then side straps, then top straps. Perform a fit check to ensure a proper seal has been established between the respirator and your face. At this point, you can pull the hood of your overalls up and do the zippers up to your chin. Check the air filters are functioning properly by blocking the inflow of air with the palm of your hand. If functioning properly, it should form a complete seal, making it impossible to inhale while your hands are closing the inflow of air. The disposable P2 particulate respirator and protective eyewear is also unsuitable for personnel who are not clean-shaven, wearing spectacles, or with facial features preventing a suitable seal. It's important to note that P2 particulate respirators must be kept dry at all times and are not effective if they become wet, for example from mucus or water splashes. Handle the respirator without touching the outside and place it across your face. Position and secure the straps for comfort, ideally with one strap each above and below the ears. Squeeze the firm structure above the nose to secure a best fit, and check the fit by opening your mouth and moving your face around to ensure a proper seal. Place the protective eyewear across your face, taking care not to touch the outside surface of the respirator. At this point, you can pull the hood of your overalls up and do the zipper up to your chin. We're now back to our original entry procedure without a respiratory protective device. Step across the imaginary line into the disinfectant tub on the dirty side of the drop sheet and proceed to wash and disinfect your boots and reusable waterproofs if worn. It's essential that you disinfect your boots even if decontaminated at a previous site. This is a biosecurity risk mitigation measure and also ensures you're not seen to potentially bring infectious agents or contaminants onto the premises. Step out of the disinfectant tub and pick up all necessary equipment and items that were previously disinfected to take onto the premises. It's important you have all required equipment, documentation, sample containers, and other items before you cross into the hot zone, as you'll need to undergo complete decontamination in order to exit the premises. This includes a bucket, detergent, scrubbing brushes, and hoof pick or screwdriver to remove and clean gross contamination at the gross cleaning site. While in the suspected or known hot zone, keep PPE on at all times. If gloves are torn, use a disinfectant wipe or spray bottle to disinfect and re-glove, using the spare gloves you brought with you in a separate clip seal bag. If at any time your PPE, other than your gloves, is breached, remain calm and seek assistance where required, or contact your supervisor or 000 in case of emergency.